Classics 107.9. Time to check in with our girlfriend, Dr. Monique Gary. What's up, Doc?
Hey, how we doing today? How's it going? Happy Thursday.
I am well. I welcome the rain today because my flowers need it. So, yeah, I'm in a good mood.
Miss Teachers is happy.
All right, Doc. In some ways, I feel like I'm talking to you about COVID-19 for the very first time as I witnessed the second wave coming and coming fast.
It's true. The boomerang is coming back around, and people need to get ready, be prepared, because across the country, the numbers are going up while our government is saying that we have overcome. They're singing we shall and we have overcome coronavirus, and that's not necessarily the case. In some states, we have legislators who are suing against the emergency declarations and trying to open things back up sooner than we should. But I want to talk today to parents who need to be aware of what to look for in their children. And we touched on this maybe about a month ago, but there's some updates there.
Okay, so we all know that school is ending, and most of our children will be at home with us this summer. And we really have to pay close attention because, like you said, the second wave is bringing about new information when it comes to our kids. Let's talk about this. What is it, an inflammatory issue that we're having with our children?
Yep, so it's called a multi-system inflammatory syndrome in children, MISC. So MISC is an inflammatory manifestation of COVID, where previously we reported that, kids were having like a Kawasaki type of syndrome, meaning they're having an autoimmune skin disorder where the skin would turn sort of red and look blistery and peeled and rashes and that sort of thing. But this is different. And so how this manifests in some children, and it seems to be a pattern, is that their child just might have some stomach pain, so who doesn't have stomach pain, right? The kid has stomach pain, they're not feeling well, maybe it's something you ate. Next thing you know, there's a temperature, 102 fever, and you take them to the emergency room, and they say, okay, you know what, in and out, give them some fluids, give them some Tylenol, the child is doing okay. And then the vomiting, and then the skin changes, and then the fever. And so it's this cycle of inflammation in the body. And when they tested these kids for it, because they're seeing a lot of these at Children's National down in D.C., they're seeing them at the children's hospitals all across the country, but when they test these kids for the coronavirus, they test negative. When they test them for the antibodies, they test positive. So,
wow.
Right, this is crazy, right? Because everybody knows by now, at least you should, if you've been listening to us the last 10 weeks, there's different types of testing for coronavirus. There's the testing, the nasal swabs, where they run it quickly. It's called PCR, and it looks at the DNA products and the RNA products. But then the antibody testing is different. It's whether or not you built up an immune response to the virus. You got infected, and your body developed an immune response, and they're testing for that response. So these kids are testing positive for the immune response, but they're not testing positive for the virus. So
that's scary.
It really is, because if you have a child who has these symptoms, stomach pain, nausea, vomiting, high fever, skin changes, which can be subtle in people of color, and you take your child to the ER and they test negative and send you home, but it persists, you need to get your child tested for the antibodies for the coronavirus.
Wow. These are scary times, Doc, and I know we love nothing more than we love our children, so we really have to keep a close eye on this.
You're absolutely right. Watch your babies, because it's coming back around, and I know everybody wants to get back out there, but you really have to be safe, be responsible. This is something that's affecting our community more than any other. So yeah, we beating the drum. Wash your hands, 20 seconds, disinfect, wear a mask, but watch your children and take them seriously if they don't feel well. Don't just brush it off as something that they ate. So take your kids seriously, utilize telemedicine, and do consults with the doctors that way if you're concerned about going into the emergency departments. But be persistent and advocate for yourself.
And keep a close eye.
We can do this, though. We will overcome this, for sure. For real, not for TV and for economy.
For sure. I feel like we had this big fight. The fight was over, and now somebody called me out for another fair one. Here we go, fighting again.
We always fighting something as a people, If it's not racism and racism in healthcare, it's viruses and everything else. So we are strong, and we are self-determined, and we're going to do this. So we got this.
Yes, we will. We will get through this together. We're going to keep on saying it until we do. Dr. Mo, thanks again for your valuable information and your time. More importantly, we so appreciate you.
Oh, I love you guys. You can follow me on social media, Dr. Monique Gary, on every social channel. And I look forward to doing it again tomorrow.
All right. Look forward to seeing you tomorrow. It's Classics 107.9. Just love that woman. We'll be back after these messages.